And just refresh my memory. How is it doing? What's going on there?
We're doing great. LUCCA Health Medical Specialty Center in East Legon. We're a multi-specialty group. We do medical consults. We do surgery. We have several specialists there, myself, gynecology, general surgery, a nephrologist who also does internal medicine, urologist, and an ENT, ear, nose, and throat surgeon. And everything is going great.
Great. Nice to know. But when I look at what I have here, says you're a general gynecologist and minimally invasive gynecologic surgeon. What is that? That sounds like a mouthful. That sounds, a bit confusing for us mere mortals.
Yes.
So who's a minimally invasive gynecologic surgeon? Who are you?
Okay, so to break it down, I do women's health, essentially. So taking care of women in terms of their overall health, but also in terms of their reproductive health. So dealing with issues having to do with the menses, having to do with fibroids, reproduction, etc. The minimally invasive gynecologic surgeon piece just highlights the fact that I also do surgery. So there's many issues that a woman may have, whether it be fibroids or endometriosis or ovarian cysts or whatever the case may be, that may require surgery. Traditionally, surgery can be done with an open incision on the abdomen, similar to a cut that will be made for a cesarean section or a CS. However, minimally invasive surgery is a way to do the surgery with much smaller cuts on the abdomen, or sometimes without any cuts on the abdomen at all. So when it comes to gynecology, sometimes a procedure or surgery may be done entirely through the vagina or the vaginal route. And it allows women to recover much faster from surgery. It allows them to have less pain and also less risk of certain complications like blood loss, infection, and things like that. So that's what minimally invasive gynecologic surgeon means.
Now we've come home. So what? It has to do with small holes?
Yes.
Much smaller holes?
Much smaller cuts. So typically there'll be between 3 to 4 small cuts. The sizes of them typically range between 5 millimeters and 1 centimeter. And they're strategically placed on the abdomen, and there are special instruments that are designed for minimally invasive or laparoscopic surgery, as some people may have heard, or even keyhole surgery is often what it's called. And these special instruments are designed to go through those small incisions, and you can do the same operations such as myomectomy, which is removal of the fibroids and leaving the uterus in, or doing hysterectomy, where the womb is removed altogether. There's also hysteroscopy, which is a way to put a camera into the womb. So if you don't need to remove anything per se, but you want to have a look inside the womb to identify certain problems, you can do that as well.
Why women? Is it because you're a woman? Is there something that you found that, why do you focus on women's health, you especially?
Well, when you go through your medical training, you do have the opportunity to go to several different specialties. So, internal medicine, general surgery, pediatrics. When I did all of my rotations, I just found that the gynecologic specialty resonated more with me, because I found that you're able to have a relationship with a woman all the way from her teen years until the menopausal years, throughout her entire life. And you really have a chance to connect with them and educate them about their health, not only physical health, but also about their general health and overall mental well-being, work-life balance, all of that. And so I like having that continuity and that relationship throughout a woman's lifetime. But gynecology is special in that not only do you get to serve a role almost like a primary physician, an internist, but you also get to do surgery. And I feel I work well with my hands, and I really like doing surgery. And so that's why I chose women's health and gynecology.
Fulfilling for you?
Fulfilling, very fulfilling, because you get a chance to really impact a woman's life in a significant way, especially when they're having issues, whether it be, pain from certain problems like fibroids, or if they have infertility issues. You get to intervene in a way that impacts their life in multiple ways and really improves their quality of life. And so it is very fulfilling in that regard.
I see. Now, for most women, you'd hear them talk about fibroids.
Yes.
And you mentioned something, uterine fibroid. What exactly is that?
So uterine fibroids are basically muscle growths within the uterus. So a woman's uterus is actually a muscle. And so fibroids are muscle tumors. And I don't want to alarm people when I say the word tumor. Sometimes we hear tumor with regard to cancer. Fibroids are not cancers. They are just a ball of muscle tissue that is formed within the woman's womb, basically.
So why are you trying? Is there a specific reason why it's called uterine cancer? Is it because the uterus?
Yes, because they grow within the uterus. And they can be located in different places. So sometimes they are located within the muscle body of the uterus itself. Sometimes they grow on the outside of the uterus, or sometimes they grow inside, like where a baby would grow.
It seems a major problem for most women, especially women in Ghana. That's my experience. And I'll ask, why is that?
So you are absolutely correct that uterine fibroids are a major problem for many women. We don't know, when I say we, I mean in the medical community, we don't know the exact reason why they grow, but we do know that there are certain risk factors. For example, being of African descent, so African, African American, Caribbean, we tend to get fibroids more than any other group of women. Also, if you have family members, so especially your immediate family, your mother, your sisters, grandmothers who have fibroids, then you are also more likely to get fibroids. But we do think that fibroid growth is multifactorial, meaning that there's probably several different things that play a role in whether a woman develops fibroids or not. So other things, such as being overweight or carrying too much weight, can increase your risk of getting uterine fibroids, or even vitamin D deficiency. So the vitamin D, like supplements we usually take or that we make in the skin from the sun. If you have a deficiency in vitamin D, which sometimes women who have darker skin can have a deficiency because the UV light doesn't penetrate as well. We think that that may also play a role in uterine fibroid development.
Are there any misconceptions about fibroid?
Many. And it's unfortunate because it really can interfere with a woman's choice to go and seek medical care for them. So the most common one that I've heard so far is that contraceptives can increase or cause fibroids to grow.
It's not true?
It's not true. So in fact, most of the time, the symptoms that are caused by uterine fibroids, like heavy bleeding or pain with menses, bleeding in between the menses, all of those symptoms many times can be significantly improved with contraceptives. And in fact, most of the contraceptives that you might use, the dosage that's in there, the dose of hormone that you might get, the female hormones, estrogen and progestin, are significantly less than what your body naturally makes. And so it's rarely the case that just because you've taken or you take contraceptives or use contraceptives that they will cause fibroids to grow in and of themselves. The other misconception has to do with how to treat them. Understandably, no one wants to take surgery or, taking certain medications lightly. But there is not any definitive evidence right now that there's any herbs that can cure fibroids. And when I say cure, meaning making them disappear. And so, unfortunately, there's the case where some women may choose to use certain herbal remedies and such. And I'm not saying that they may not help with the symptoms, because I actually do like a holistic approach to things. But if it's the case where you're utilizing these things and you find that you're still having the problem, don't think that, there's nothing else you should do or you shouldn't go and seek care. There are some cases where the herbal treatments may not be enough to take care of the problem that you might be having related to fibroids.
Well, so what are some of the problems women with fibroids generally experience?
So, as I mentioned, the most significant one is the heavy menstrual bleeding or prolonged. Sometimes, on average, a woman's menses will last anywhere from 3 to 7 days, depending on the woman. And that can be within the range of normal. But if it's lasting 2 weeks or you're bleeding throughout the entire month, or let's say your menses actually comes for a specified number of days, but then in between you're also bleeding again or having spotting, or if you're having significant pain during intercourse, things like that, those are the common things that women will present with, or that might make a woman suspect that she has uterine fibroids. There's also potential for issues with pregnancy or with even conceiving, with fertility in the first place. And I say potential for because sometimes women may have fibroids and they don't always cause that problem. But in some cases, these are the most common things that women will present with.
And is surgery always the best way out?
Not necessarily. So the decision to treat uterine fibroids, whether it's with medication or with surgery, depends on what a woman is experiencing. So there are cases where women may have fibroids, maybe there's 1 or 2, they're small. The location of the fibroid also makes a difference. So if they're mostly on the outside of the womb, she may have no symptoms at all, and it's just incidental, maybe during a routine women's health where they get a pelvic scan, and then there may be some fibroids noted there. If you're completely asymptomatic, asymptomatic, meaning you're not having any issue at all, you don't need to have any intervention at all. We just monitor them and make sure that they don't grow rapidly or start to cause any problems. However, for certain fibroids, those should be removed surgically. So, for example, if you have fibroids that are causing you significant symptoms, excessively heavy bleeding to the point where you're becoming anemic and you needed to take iron supplementations all the time, or if you are having fibroids that are found to be within the cavity of the uterus itself, meaning where a baby would grow, we do know and have evidence that those types of fibroids within the womb themselves can cause fertility issues, meaning you might not be able to conceive, or if you do, you might miscarry, etc. So if we identify those types of fibroids, those should be removed. Also, if you have one or many fibroids that are very, very large, especially if you're very young, your 20s, 30s, and you have very, very large fibroids such that they're pressing on other organs in your abdomen, then in that case, you should have surgery to remove those as well.
What options are available at LUCCA Health?
So you can have either a traditional open abdominal surgery, like through a CS cut, like I mentioned earlier, but then also the laparoscopic or minimally invasive route is available as well. But the decision in terms of which type of surgery is the best approach really depends on many things. It depends on whether or not a woman has had children before or is just at the beginning trying to conceive. It also depends on the number and the size of the fibroids in terms of which approach, meaning the open approach or the laparoscopic approach, is better. When a woman has not conceived before, and let's say there are many fibroids, we're talking about 10, 20, 30 fibroids, sometimes doing a laparoscopic approach is not the best or the safest. And the reason I say that is because you have to cut into the womb itself to remove all of those fibroids. And when there are many fibroids or they're significantly large, there's a potential to make many, many cuts on the womb. Now, as a surgeon, we always try to remove as many fibroids as we can through as few cuts as possible. But depending on the number of fibroids, sometimes it's not always possible to make few cuts. And so there's potential for plenty bleeding. There's potential that in closing the womb back together after removing the fibroids, the integrity of the closure may not be as good as it could be with a laparoscopic or minimally invasive approach. So in that regard, sometimes doing the open incision is the best and the safest in terms of the future, the womb being able to maintain the pregnancy, etc. But I'm sorry?
No, you finish.
Apart from surgery, you can also use certain medications depending, again, on the symptoms. There are some women who, let's say, are close to menopause. Menopause is when the ovaries stop functioning. They're not making the hormones anymore, so the ability to conceive goes away. And so if conception is not an issue, there are some cases in which if you're close to menopause and the fibroids may have a chance to shrink, which frequently happens after menopause because they're not stimulated from the hormones anymore, then you can either just watch and wait, or you can use other modalities to try and shrink the fibroids and relieve the symptoms. So there's something called uterine fibroid embolization, and that's not something that's done at LUCCA Health, but we have colleagues that we have partnered with who can do it, and that's just a way to block the blood flow to the fibroids so that they may shrink and the symptoms will be resolved. Or sometimes even there's a medication that you can use just for the short term for a year or so, and then that can help to shrink the fibroids until the woman actually enters menopause, and many times that's all that's needed instead of going through with surgery.
Finally, what's the biggest size fibroid you've seen, or how big can a fibroid grow? Because somebody just sent me a message and says that some grow as big as little babies. I don't know.
Yes, it is true.
True?
Yes, it is true. And so I would say maybe about, was it 4 or 6 weeks ago? I just removed one from a woman, and based on the scan that I gotten on her, the fibroid size was about 18 centimeters, which is very large. And when I took it out, it was like the size of a small newborn baby.
How much did it weigh, if you weighed it?
It weighed 3.3 kgs.
You're joking.
No, I'm serious. So it was
fibroid.
Yes, fibroid. So it was quite large. It was quite large. And so these things can grow to be very sizable. And sometimes when you see a woman, they may look like they're pregnant, but they're not. It's actually fibroids. And so
3 kilograms.
3 kilograms. Yes. And there are some that have even been measured as heavier than that.
Fibroid.
Yes, fibroid can be that large.
That's like a whole pregnancy.
Yes.
That's like you're carrying a baby.
Yes, yes. And that's why sometimes it looks that way. And so that's why and the thing about it is that, especially here in Ghana, as opposed to in the U.S. where I practiced previously, I have seen larger fibroids here than I've ever seen there.
Why?
And so it can be a very significant
issue. What is it?
I do think that there may be dietary factors that play a role. It's just that we haven't identified the key. Like, it would be nice to say, okay, if you stop doing X, Y, and Z, then fibroids won't grow. Or if you avoid this, then fibroids won't grow. But we haven't figured that out yet. But right now, we just know that, there are the genetic factors. We know that there's ethnicity factor. And like I said, in terms of food, perhaps vitamin D deficiency, increasing vitamin D intake, and managing the weight. If women control their weight a bit, sometimes that may also reduce the incidence of fibroid formation.
Wow. So sometimes a woman may look pregnant, but it's not.
Yes, which is why no one should ever go and ask a woman, when is she due?
Yeah, that's true.
Yes,
that's true.
Because sometimes it's not actually a pregnancy.
You may assume, and
Exactly,
anyway.
exactly.
Okay, now, tell us, where's LUCCA? Somebody's listening to you right now, may want to access your services. Where do we find LUCCA Health?
Yes, so LUCCA Health is located in East Legon. We have 2 campuses. The main campus is at 27 Masaru Street, which is actually on the campus of MDS Lancet and Quest Medical Imaging. MDS Lancet Laboratories and Quest Medical Imaging. It's very near the Mensvik Hotel off of Lagos Avenue. The second location is actually on the same campus with Acacia Medical Center, and the street address for that is Justice E.P. Soa Avenue. So, we are around.
Well, a little education always helps.
Yes.
So when you see a woman with a big stomach, don't go and ask her when she's due. Lord. Anyway, thank you, Doc.
Thank you so much for having me.
Have a beautiful day. Dr. UDELE TAGOE,
well.
general gynecologist and a minimally invasive gynecologic surgeon. Now, that's a mouthful, but she gets her job done. That's the most important.
Peace FM.